Hi, I'm Jamie Gilroy here to introduce the new Shukla knee extraction system. This is an extraction system that we've been working on for quite some time now with quite a few surgeons around the country. Most importantly, Dr. Chang, who helped us develop the Chang femoral and the Chang tibial extractor, which I'll show you here in a little bit. The great thing about this system is when we launch it into the market, there is virtually no competition for this system. When I say no competition, Shukla doesn't typically have competition, but for universal systems, but there are systems out there, like the DePuy hip stem removal system, the Stryker hip stem removal system. They have their own IM nail systems out there. Synthes has their broken and strip screw removal system. So there are systems that somewhat compete with us, but when launching into the knee arena with total joint revision surgeons, there aren't any systems out there. The doctors are using a hodgepodge of chisels and tools to remove the tibial and the femoral components during a knee revision, but as far as other systems go, there really aren't other systems that claim to be knee extraction systems. So it's a great system. It's one that's going to give you exposure to total joint surgeons. As we know, that call point is a 7-set call point now. So it's a big call point for us. It's our biggest call point. So the revision total joint surgeon should be your primary target with everything Shukla. So let's go ahead and get started in introducing the set. So if you're looking at the set, we have your retrograde blades, your tibial extractor, your femoral extractor, some nuts, some wrenches, and the Z blades. And in the bottom portion of the tray, we have our two-handed mallet with the silicone handle. That's a nice upgrade. We have the upgraded C-frame with the handle on the back, and you'll see when we position it on the knee why the handle's on the back. We have the slotted mallet that's used with the chisels. We also have our vertical post and our handle for the chisels as well. So when you're looking at a knee and you're looking at the difficulties during revisions of a knee, what they're doing is they're retracting the patella off to one side. So this gives them exposure right here. So when they're looking at the knee, they've got tissue all around the femoral side, and a quarter of the tibial side is also covered. So the access isn't all that great. So when you look at the design of the pieces in our system, they're designed to help the surgeon overcome these restrictions as far as access goes. So the first thing the surgeon is going to do is he's going to take a bunch of chisels in and around both the femoral and the tibial component. So we have made some great Z blades and retrograde blades. So when they use the Z blade, you'll see here they drop it into the handle, they lock it tight so that it's locked in there, and then with that tissue around the femoral, this step really helps them get in, and they love this. They actually love getting in and over the tissue on the femoral component on the outsides and somewhat on the insides. Now most femoral components are just cemented to the femur. Some do have a post. Those are typically revisions of revisions, but majority of the time they're just going to go in and around the femoral side with their Z blades. So the Z blades are really popular. Make sure you're showing those to your surgeons. We also have different length, width, sizes of the retrograde blades. And what this is used for is when you're looking at a knee, you've got the patella retracted off to one side, and most of the bone loss is on the posterior side of the tibial component of a knee. And there's a reason for that. These are called keels. Most knees have these keels. They're like keels on a boat. So when a surgeon is working from the front side of a knee, which is pretty much all the access that he has, he'll be chiseling in and working that 3/4 angle, but he'll be hitting those keels with his chisels. So the bone loss back here is almost constant with everybody's knee. So what we did was we made retrograde blades. So what these retrograde blades allow the surgeon to drop in and behind those keels and cut that bone from the cement, and they love these. And so they'll be using that along with the slotted mallet, and with the slotted mallet, once they drop it in, they can hit that and break up that interface. So on a knee, they'll be working in just like this to cut that cement away from the knee, because their whole goal, and if you talk to a total joint surgeon, is zero bone loss on a knee. So it's really nice to have these tools that allow them to get into these restricted areas that they were never able to access before. The Z-blade is also good for what they call the posterior lateral corner. So what they'll do is they'll actually drop it in and behind this step and hit that posterior lateral corner also with the Z-blade, cutting that cement out of there. That way when they go to extract both the femoral and the tibial side, they've really done a great job of minimizing their bone loss, which is why these blades are just really a home run. Zach and the surgeons that worked with us did a great job of coming up with the proper protocol there. So now that they've got the cement clear from the implant itself, then they're going to move to the extractors. So here's the femoral extractor. It is a vice grip extractor, just like say our hip. It clamps down the same way. There is a sliding lock, and we'll talk about this a little more. I just wanted to show you guys all the sliding lock. It has an unlock side and a lock side. And the surgeon, when he clamps down on the implant, he's going to want to lock this, because when he goes to put the vertical post on and then smack on the C-frame, this was jiggling loose. So last minute, we created this lock that actually will lock this down once it's clamped onto the implant itself. One word of caution: when the surgeon is getting ready and he's putting, please train them to make sure that this is unlocked, because if it's locked before they clamp down, they won't be able to clamp down and they'll get a little frustrated. So it's important that this is unlocked before they clamp down. Another recommendation is have the tech in the OR put the vertical post onto the extractor itself before they go and lock on the implant. It just helps with the speed of the case and just the fluidity of using our system. So on the femoral side, you can see that it's a pretty wide side. So what we did was we made teeth that are actually pretty wide that go from side to side. And you want to ensure that these teeth get locked underneath the implant. Once the teeth are locked underneath the implant, then you clamp it tight, lock the lock, you hook your C-frame on, and you pound away out of there. But you want to make sure that these are underneath the implant. The reason for that is these teeth are very powerful for pulling, but they're not very powerful for grabbing. So if they try to grab the implant in here rather than these underneath the implant, they'll actually bend outwards. So just when you're in servicing, please do make sure that they're going in and under the femoral component rather than grabbing onto the outside and trying to clamp onto it like a vice grip. So that's important, but really nice outside to outside clamping, lock, hook your C-frame up, and you can extract your femoral component. A lot of docs, if it doesn't have the femoral post down here, will still just take their bone tamp and just pop this off. That's okay. They'll use this when they deem fit, and when they don't think they need it, they'll just use a bone tamp. And it's not a knock against our system. It's just they're going to do what they feel comfortable with. The majority of the use with our system will become in the Z-blades, the retrograde blades, and then the tibial component. So once again, you want to hook your post on before you attach onto the tibial side. The tibial side, 99% of the time, has a post down there. So this is where they really need the help for the extraction of the instrument. So different from the femoral component, you're going to lock back to front. So the little tooth goes in the little slotted design on the back, just like that, and then the bigger tooth goes up on the front, and then they'll clamp down. So just like on your knee, you'll come in, you'll tighten it. Once you get to that sweet spot, lock on there. Just a word of caution too, always make sure they tighten everything, because as they start hitting with the hammer, things will jiggle loose. But then you hit your C-frame, and you can see here the handle is on the back, because when you're working on the knee, it's much higher, much different angle than on the hip. you would tighten that down, and then you just come in, and with your C-frame and your mallet, you knock that tibial component out. This is really where surgeons are going to love our system. The femoral component may be over-engineered, the femoral extractor, but there are times where they're going to need it, so it's very nice to have it in there. But probably 80% of the time they're just going to take a bone tap and pop that right off. So once you get that out, they're pretty much done with what the knee system allows them to do. So when we launch, we're going to provide you with a retrograde blade, probably a zebra blade. We're going to give you a demo knee unit, and then we're also going to give you probably a tibial extractor so that you have all of this in your black demo kit to help you sell. But that's not where it should stop. All of you should have 3 important videos, because it's going to allow the surgeon to see in a surgical setting exactly what to do. So here, if you don't have these videos, email me, but here's a great video of Dr. Whiteside using the retrograde blades. This video is kind of long, but if you just let it run for a couple seconds with the surgeon, he's going to get it right away, and that's a great video to show. Then after that, we have a tibial extraction video, and this is Dr. Greenbaum, and he shows the connection from back to front, how he locks it on there. Once he gets it locked on there, then they put the vertical post on, and then he uses the C-frame and the mallet, and you'll see it's very effective in removing that. So another product that we're also launching that helps with the knee, and will be launched in a little while, is a conical trephine. The conical trephine is a coring cutting reamer that actually collects cement up into the canal itself. And so when they remove the tibial side of the knee, there's cement down in this canal that is a tedious removal process that takes about 15 to 20 minutes of chiseling and tedious work to remove that cement. With our coring reamers, they put this on a drill, put it in forward, and as it's spinning, it actually cuts and collects the cement up into the canal, and in less than 30 seconds, they'll have that cement reamed out. And another important video to have is this video right here. And you can show the surgeon, hey doc, look how fast and easy it is to remove the cement from the tibial canal once your tibial component's removed. And this video really will get you to the next step of doing a free evaluation. So when we launch this system, it's a 2-set sale, because everybody that's interested in the knee is most likely going to be interested in the conicals, and the conicals will be a nice disposable. So with all that said, if you have any questions, please feel free to call me. But it's a pretty incredible set. We expect a lot of sales. We've already sold several. And hopefully it'll help you expand the business with the total joint surgeons, with the maxi, the hip, the modular, the broken and strip, the Winquist, and now the knee and the conical. So let's get to selling, and if you have any questions or needs, always call me. Thank you so much.